Bismillahirrahmanirrahim. Assalamu alaikum, respected and honorable audience. Today we are going to talk about human personalities and some human personality traits which are associated with some diseases. Many times we see around us our colleagues, our friends, family members who are very hardworking, focused, fast-paced, fast thinkers, always focus-oriented. They want to achieve something. If you talk to them, they will not be diplomatic. They will talk straightway, blunt we say. And they're multitaskers, doing too many things in one setting. Yes, I am talking about type A personalities. The people who have such traits, of course, because of constant stress, they are prone to different diseases. We can say sometimes they develop high blood pressure, cardiac issues, these things. But as an eye physician, there are some diseases which are associated with these type of personalities, who are fast-paced, fast thinkers, quick decision makers, always thinking something and focus-oriented. They want to achieve their goals, and many things they will be doing, you will see them trying to accomplish. These are type A personalities. And when we talk about eye, there is a disease which is called CSCR, Central Serous Chorioretinopathy, and it has strong association with these type of personalities. So today we will talk about this disease. We talk about this disease. It was first time documented by von Graefe in 1866. That is more than 150 years back. We trace its documentation, that it was documented. And in 1967, Dr. Gass and his colleagues finally established this diagnosis. So usually when these patients come to us in our clinics, they are in their 20s or 30 years of age, and they complain of blur vision. Things appear distorted to them in one eye. Sometimes different shapes are distorted. If they look at a square pattern, they will say that its edges, its corners are broken, wavy like this. Things appear smaller in size, and this blurring of vision is usually central. The reason behind this central affected vision is that this disease, as I mentioned earlier, affects type A personalities usually in their 20s, 30s, 40s. It affects the central area which I've earlier described in different videos, that is called macula. The whole area is called posterior, where the images form is retina of the eye. But macula is that area which has got highest concentration of photoreceptors. So when this area, or you can say 90% of our vision is there in this macula. I will show you this area again in our further diagrams, but it happens when this area is disturbed, person gets such features which I told you, the wavy patterns of the lines over there, things appearing smaller than size, central blurred vision. And these patients usually complain that I had this problem, then it settled down, and after some time it again develops. So these are repeated episodes, repetition in these patients. So it is now almost more than, I can say, 150 years that clinicians are dealing with this disease. And now we'll discuss further about its investigations. The type of photography called autofluorescent, and here in the red circle I have tried to show how this central area, although it is not three-dimensional vision and it will be difficult for you to appreciate, but this is the area next to the optic nerve. Optic nerve is the area which takes messages from the retina to the brain. Just next to it is the macula, and here all these things are happening. It is not very much appreciable, I know, but in the next slide I will show you in the cross section and an investigation OCT where we can see the fluid also. So now we are looking at the OCT. OCT is an imaging device, imaging technique in where we see all the cross sections. Earlier we were seeing the retina, elevated retina, fluid was under it. But now we are looking at it in this direction. All its layers are over there. And here in this photograph, we can see that there is accumulation of fluid and the retina, sensory retina, is elevated. This is CSCR. Now the problem with this technique is, this disease, that it is in the centralmost part of the eye. Usually, we ask patient to wait and these things settle down at their own. No intervention is required. But sometimes what happens, that patients go into a chronic phase and he says, doctor, I cannot see properly. I cannot focus. It is disturbing my quality of life and I am having problems. So in this stage, the doctors have brought a technique which is called photodynamic therapy. Photodynamic therapy is that a dye is injected in human body, Vitidine, and once it dye goes over there in these blood vessels which are leaking over there, this dye is activated with, I should say, laser, which is cold laser, which is not very harmful, which power is very low, minimal. And this laser, just rather than burning or destroying over there the laser which are high powered, this laser basically activates this dye, this medicine which has reached the choroidal blood vessels. And once it is activated over there, it leads to certain changes in those blood vessels. They start closing over there, getting occluded. And this is a very effective way to treat these vessels. Why this technique has been chosen? Why not straightway laser applying? The reason is, this is one of the most sensitive area of human eye. Human eye is very sensitive, and in human eye, the macula, and in macula we are going right in the center foveal area. So we cannot apply direct high intensity lasers over there. It will burn over there and a permanent scar will be formed over there. So this photodynamic therapy is very safe in this, which physicians can apply over there considering all the pros and cons. So this is a disease which we encounter in our patients who have got certain personality traits, type A personalities. We do counseling, we tell them to do modification in their behavior and try to control the stress. And once acute phases, it settles down, but it keeps on repeating and it goes in chronicity, it is not settling down, then we can offer this treatment. So this was basically today's my topic of discussion, in which we discussed that CSCR. Usually anxiety and these things are associated in medicine with high blood pressures, cardiac patients, stroke happening, all these things. Blood sugar not getting controlled. But in ophthalmology and eye diseases, we also encounter patients. We also have such diseases which are related to human personalities. So I hope my today's discussion, brief description, will be beneficial to my respected audience. I want to thank you for your attendance and attention. Thank you.